Okay, so I have already verified my MAR to my doctor's orders and made sure it was correct. And that was at the nurse's station. Then I went to the medication room. I pulled my medications and did two verifications, medication checks on the medication. And so now I'm coming to the patient's room. So knock, 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 come in. Good morning, my name's Jan Buckskemper. I'm a registered nurse and I'm here to give you your 9 o'clock medication. So let me get this rubbed in good. Let me pull your chart up. Okay, so we've got your chart up and I'm gonna, so can you tell me your name and date of birth? Brad Smith, 4/24/1957. And I've got Brad Smith, 4/24/1957. So that matches. I'm going to go ahead and put my scan ID right there. Scan your ID. And are you allergic to any kind of medications? Codeine, all right, and that's what I've got here. Now, what does codeine do to you? Just kind of makes you feel all jittery? Okay, well, we're not going to be giving you any codeine today, but we're going to be doing your inhaler. So before, I'm going to go ahead and do my third check, and then we're going to go ahead and get started. So let me do that first, and then I'll explain everything to you as we go. So I've got Smith Brad, date of birth 4/24/1957. Okay, Proventil inhaler, 2 puffs daily. This is going to be the 9 o'clock dose. And in my hand, I have Proventil. It's an inhaler, and we're going to do 2 puffs daily, and this is going to be the 9 o'clock dose. Okay, so that's my third check. I'm going to scan my medication. So Proventil, and this is an inhaler. Okay, so third check, scan. Okay, Mr. Smith, this is a bronchodilator, okay? And so it's going to help open up your airway so you can kind of breathe a little bit better, all right? Now, some things that it can cause you to kind of feel restless, maybe have a little bit of anxiety with this, but it'll go away. It's just initially sometimes that will do that. Sometimes it won't help. It can also cause some bronchospasms, so you may feel like you're not breathing good. And we're doing 2 puffs, and so we just make sure you let us know if any of that's happening, okay? And so with this, I'm going to go ahead and sit you up. Okay, so with the bronchodilator, we're going to pull the lid off. We're going to shake it good, okay? So you're going to be doing this at home, so you need to shake it good. Then you need to depress it to get rid of any kind of debris or anything in there. And then there's several ways that we can do this. A lot of times they want you to hold it 1 to 2 inches away from your mouth. Some people put it in their mouth if that makes it easier for them to inhale. Sometimes we may need to use the aero chamber where we stick this in here, we disperse the medication, and then you can inhale if you're not able to coordinate that. But we're able to coordinate that today. Okay, so we've sprayed it, we've shook it. I'm not going to be getting any of this on me, but I'm going to go ahead and put some gloves on. And then with this inhaler, since we're doing 2 puffs, we've got to wait a full minute in between, okay? So you want to hold it in your mouth? Okay, so what we'll do is I'm gonna depress, and I'll let you know when I say depress. I want you to take a slow, deep breath, okay? So you're gonna inhale this medication, and we're gonna count 1, 2, 3. You're gonna hopefully hold it for about 5 seconds, 5 to 10 seconds, and then through pursed lips, let it out, okay? All right, so on the we're gonna, I'm gonna say depress, and when we do that, you're going to inhale, okay? Depress, inhale. 1 to 2, 3 seconds. Hold it 5 to 10 seconds, and then breathe through pursed lips out. Okay? All right, now we need to wait a full minute between the puffs. Okay? So we're going to wait our full minute. While we're doing this, since I don't have any other medications, we could be talking about, I can be straightening up your room, asking you, how are you doing? When was the last time you went to the bathroom? Do I need to get you up here in just a little bit? No? Okay. And you have any family coming? No? Okay. So they'll be, but they're coming later. All right. Well, we'll watch for them to come in, and so we'll also be teaching them about your medication. And so we're going to wait our full minute. And then we're going to give you your next one, and we're going to do the same thing. So we're going to hold it in there. I'm going to depress it as you inhale, and hold it for count 1, 2, 3 as you're inhaling, and then hold it 5 to 10 seconds if you can. Okay, all right, so here we go. So depress, inhale, 1, 2, 3, hold it 5 to 10 seconds, exhale through your pursed lips. Okay, all right. So I'm going to go ahead and clean the mouthpiece off and put that back in here, and we will keep this in your tray, and it'll be in the medication room. And then I need you to, we're going to need you to rinse your mouth. Okay, so rinse your mouth and spit that out. Okay, we'll clean that up. We'll go put that in the bathroom so we can clean that out. Okay. All right. And how are you feeling? You feeling okay? Okay. I'm going to do my glove to glove, skin to skin. I'm going to do a medical hand wash. And again, sometimes it can kind of make you feel jittery. It should make you breathe easier. That's the goal. And then, but if it does kind of feel you a little anxiety, let us know, but that typically is normal, and it'll go away. Okay, so I'm going to come back over here, and I'm going to, all I have to do is just initial, because I don't have to put anything specific on there, and so just my initials, and then I need to sign down here, J. Bucks Kemper. My credentials, and then my initials. That way anybody that has any problems knows that JB is Jan Bucks Kemper, and I'm the one that gave those medications. Okay, so once I've charted all of that, then I'm going to go ahead and shut down my computer. Okay, so we've shut down our computer. I've got the bed in the lowest position, side rails up ×2, the wheels are locked. Here's your call light. Are you good with, I'm going to put your head down just a little bit, okay? Feel like you're already breathing a little bit better? All right, well, good. All right, so if you need anything, just put your call light on. And I'm going to wash my hands. As I exit the room. All right, thank you, and call us if you need anything.